Welcome back. Finally, we're seeing some relief from COVID. Local case numbers are down, but that doesn't mean we're out of the woods yet.
Now joining us now to make sense of all of this, the COVID and how it's affecting our health, is infectious disease specialist Dr. Ruth Berggren with UT San Antonio. Dr. Ruth, always a pleasure to have you with us every week. Now, Metro Health, we know, reported 404 new COVID cases today. Obviously, that's well below the 1,000 plus daily case numbers that we were seeing just weeks ago. But if you can, just put that 404 into perspective for us. Is that a good sign?
We are definitely on the way down from this big mountain of a surge from Omicron that we've had, but we're still at 17.9% positivity in the community. And if you remember, what we strive for is to get down below 10 and ideally below 5. And that percent refers to, of all the people going to get tested for COVID because they think they've have it or they were exposed, what percent are positive? And so when that number goes down to 5%, you can really start to breathe more easily and talk about, maybe not having to wear your mask all the time. We are not there. It's going to take us another 2 weeks at least to get down to 5 to 10% positivity rate. The hospitals, meanwhile, are still stressed. I was rounding today. It no longer feels like we're in the throes of a horrible crisis as it used to. However, there are lots and lots of people in the emergency room, and every day we get messages from our chiefs telling us to please help move things along because folks are waiting in the emergency rooms to get in. So you don't want to get sick.
Yeah, interesting what you're seeing at UT Health San Antonio as well as University Hospital. Talk about the number of people that are vaccinated that are getting sick or hospitalized. Any idea the kind of percentages that we're talking about there?
Yeah, so I think rather than talk about percentages which change, it's helpful to talk about some big principles. And there's been some studies released recently that are exciting to me, and I want to share that people who have had long COVID, who get vaccinated against COVID, actually have a reduction in their symptoms. So if you have long COVID and you've never been vaccinated, go get vaccinated. That's an important piece of information. These same large studies, it's an aggregation of a bunch of studies together, also showed that people who've never been vaccinated against, who have been vaccinated against COVID and then get COVID, have a reduced risk of getting long COVID. So people who worry that don't get vaccinated because you can still get COVID, don't worry about that because you are preventing lots of bad things. You're preventing hospitalization and death. For the most part, hospitalization, you're certainly preventing death. You're also preventing long COVID.
Very interesting numbers there.
Now, you just mentioned a moment ago that you think in about 2 weeks we're going to continue to see these numbers go down, and maybe in 2 weeks we might see the most improvement. However, we know that already weeks ago some local school districts got rid of their mask mandates, and I'm assuming that you think that's not appropriate. It's not time for that yet, to ditch the masks.
No, it's not time to ditch the masks. I am personally wearing a KN95 mask or a surgical mask or double surgical masks every time I'm indoors with other people. I only take my mask off when I'm outside or when I'm in my own home. And I strongly urge others to do likewise. I strongly urge school children to keep their masks on. Getting COVID is no fun, and you can get COVID anytime. We still have 17.9% positivity in the community. So keep your masks on and don't get COVID because you don't have to.
Dr. Berggren, I have heard the theory that the numbers are basically, and this is nationwide, not just in San Antonio, that the numbers are likely underreported because so many people are taking tests at home, and if they turn up positive, then they quarantine and things like that. Do you believe that is still a fact? And are you still hearing from people on a daily basis who are getting COVID, who need medicines to get better?
It's absolutely the case. In the last week alone, I get 1 or 2 or 3 calls every single day from people that are in my social circle or in my world somehow that get referred to me, and I'm having to prescribe for them medicines. Good news is I have something to prescribe. We have Paxlovid, Molnupiravir, fluvoxamine. We have really good medications now that can help people stay out of the hospital and prevent them from getting desperately ill. But the fact that I am seeing so many calls from so many people tells me that, in fact, the numbers that are being reported on the websites are definitely lower than what's happening.
Now, as we head into the spring now, what are some things that we also need to be aware of? And the reason I'm asking that question is kind of side by side with the question that I asked you before, which is that, yeah, numbers are going down. However, during these last 2 years, we have been on a roller coaster.
Well, what could happen is that we could get a break for a couple of months, as we did back when the Delta surge ended and before the Omicron began. And there could be another variant that would emerge from somewhere. If that happens, we're not going to panic. We're going to continue to do what we know how to do, and we're going to continue to promote vaccination. But because that is a reality that could happen, all the people that are unboosted right now in San Antonio, they need to go and get their boosters. Absolutely go get your boosters. Protect yourself against the next variant that may come along.
Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio. As always, appreciate your time and your insight.
Thank you.